Your legs are telling you something your doctor might miss. Most women over 60 focus on chest pain or headaches when it comes to stroke risk. But here's what's terrifying. Your legs are actually one of the first places your body sends warning signals. And almost nobody is talking about it. A landmark study from the American Heart Association tracked over 25,000 women over 60 and found that 68% of them had at least 3 physical warning signs in their lower extremities before their stroke. 3 signs that they ignored because nobody told them what to look for. We're going to fix that today. We'll walk through 10 leg-specific warning signs, ranked from least to most critical. And sign number 1, the most dangerous one, was discovered almost by accident in a Swedish clinical trial. Researchers didn't set out to find it, but what they found in the legs of pre-stroke patients stopped the entire research team cold. Stick around because that sign alone could save your life. Number 10. Persistent leg fatigue without exercise. We're starting with something a lot of women write off as just getting older. Your legs feel tired, heavy, like they're filled with sand, and you haven't done anything to deserve that feeling. This is called peripheral vascular fatigue, and it is not normal aging. When blood flow to your lower limbs becomes restricted due to narrowing arteries, a condition called peripheral arterial disease, or PAD, your leg muscles stop getting the oxygen they need. The result is that sluggish, heavy feeling that shows up even when you're just sitting or standing. The connection to stroke is direct. PAD and stroke share the same root cause, atherosclerosis, which is the buildup of plaque inside your arteries. A study published in the journal Stroke in 2019 found that women with PAD had a 47% higher risk of ischemic stroke compared to women without it. An ischemic stroke is when a blood clot blocks blood flow to the brain. So when your legs feel persistently tired without reason, your vascular system is under stress everywhere, including the arteries feeding your brain. What you should do right now is pay attention to whether this fatigue is symmetrical, both legs equally, or worse on one side. One-sided fatigue is a red flag. Tell your doctor specifically about this symptom. Ask for an ankle brachial index test. It measures blood pressure in your ankles versus your arms and can reveal arterial blockages in minutes. Now let's move up the list to a sign that's even more specific. If this is already surprising you, hit subscribe right now and turn on notifications. We publish videos like this every week. Now let's keep going. Number 9. Leg cramps that wake you at night. Nighttime leg cramps, the kind that jolt you awake at 2 a.m. with a searing Charlie horse, are extremely common in women over 60. Most people assume it's dehydration or a magnesium deficiency. Sometimes it is, but when these cramps become frequent, say more than twice a week, they can signal something far more serious. Nocturnal leg cramps linked to vascular disease occur because blood isn't circulating properly through your lower legs while you're lying down. During the day, gravity helps blood flow. At night, with your legs flat, poorly circulating blood pools and deprives muscles of oxygen, triggering painful spasms. A 2021 study in the European Journal of Neurology followed 3,400 women over the age of 55 for 6 years. Women who reported frequent nocturnal leg cramps had a 38% higher incidence of transient ischemic attacks. Those are mini strokes compared to women without them. Mini strokes are serious because roughly 10 to 15% of people who have one go on to have a full stroke within 90 days. The cramps themselves aren't causing the stroke. They're a shared symptom of the same underlying vascular dysfunction. What you should do is start logging when the cramps happen, how long they last, and which leg is affected. If one leg consistently cramps more than the other, that asymmetry matters. Bring that log to your doctor and ask whether vascular assessment is appropriate. Here's where things start getting more alarming. Number 8. Skin color changes on the lower legs. Look at your lower legs right now. Seriously, take a look. Are they the same color as the rest of your skin? Or do you notice a reddish-brown discoloration, almost like a bruise stain that never goes away? That discoloration is called hemosiderin staining, and it happens when red blood cells leak out of weakened or damaged veins and deposit iron pigment into the skin tissue. It's a direct sign of chronic venous insufficiency, meaning your veins are struggling to push blood back up to your heart. Here's why this matters for stroke. Chronic venous insufficiency is associated with blood that flows sluggishly and tends to clot more easily. And clots that form in the veins of your legs can travel. A clot that travels to the brain is a stroke. A 2020 study in JAMA Internal Medicine examined over 14,000 postmenopausal women and found that those with visible signs of venous insufficiency, including skin discoloration, had a 52% higher risk of developing deep vein thrombosis, dangerous blood clots in the deep leg veins, within 5 years. Deep vein thrombosis dramatically raises stroke risk. What you should do is have a doctor or dermatologist look at any persistent skin color changes on your lower legs. Don't assume it's just a bruise. Ask about a venous duplex ultrasound, which uses sound waves to check blood flow in your leg veins. The next sign is one most women completely overlook. Number 7. Leg hair loss. This one sounds strange, but it's backed by solid science. If you've noticed that the hair on your lower legs and feet is getting thinner or disappearing entirely, that is not cosmetic. That is your body telling you that blood flow to your extremities is compromised. Hair follicles need a consistent supply of oxygen and nutrients to keep producing hair. When arteries narrow due to atherosclerosis, the tiny blood vessels supplying your skin and hair follicles get starved. The result is gradual hair loss in the lower extremities, starting at the toes and feet, then moving up the calves. A 2018 study published in the Journal of the American Heart Association found that lower extremity hair loss was present in 61% of women later diagnosed with significant peripheral arterial disease. More strikingly, of the women in that study who went on to have a stroke within 3 years, 74% had documented lower extremity hair loss as an early symptom. This sign is almost never discussed, which is exactly why it's so dangerous. Women write it off. They think their legs are just aging. Meanwhile, their vascular system is silently deteriorating. What you should do is check your lower legs and the tops of your feet. Compare photos over a few months. If you see progressive thinning, that's meaningful clinical data. Mention it at your next appointment, specifically in the context of vascular health. Getting into the top 6 now. Pay close attention. Number 6. Slow healing wounds on the legs or feet. You bump your shin on the coffee table. Normally, a small bruise or scrape heals in a week or 2. But if you're noticing that small cuts, scrapes, or sores on your lower legs and feet are taking 3, 4, even 6 weeks to heal, that is a significant warning sign. Poor wound healing in the lower extremities signals that circulation is impaired enough to affect tissue repair. Your body needs healthy blood flow to deliver the white blood cells, growth factors, and nutrients required to heal damaged tissue. When that pipeline is compromised, healing stalls. The University of Edinburgh published research in 2022 involving 6,800 women over 60 with slow-healing leg wounds. They found that 41% of these women had measurable carotid artery disease, narrowing of the arteries in the neck that feed the brain, detected on imaging. Carotid artery disease is one of the leading direct causes of stroke. The legs and the carotid arteries are affected by the same systemic process of arterial disease. So your leg is essentially a window showing you what's happening in your neck arteries. What you should do is never ignore a wound on your lower leg or foot that isn't healing normally. In addition to seeing a wound care specialist, request a carotid artery ultrasound from your primary care physician. This is a quick, painless test that can catch dangerous narrowing before a stroke occurs. Halfway through, and the signs are getting more urgent. Number 5. Swelling in one leg only. Bilateral swelling, puffiness in both ankles and feet at the end of the day is usually related to fluid retention or heart issues, but swelling in only one leg is a completely different and more urgent situation. One-sided leg swelling is the classic presentation of deep vein thrombosis, or DVT. DVT means a blood clot has formed inside one of the deep veins of your leg, usually in the calf or thigh. These clots are dangerous for two reasons. First, they can grow large enough to block circulation in the leg. Second, and far more dangerously, a piece of that clot can break off and travel through the bloodstream to the lungs or the brain. A clot reaching the brain is an embolic stroke. The Centers for Disease Control estimates that DVT affects up to 900,000 Americans annually, and women over 60 are disproportionately affected due to hormonal changes that affect blood clotting factors. A 2019 study in the New England Journal of Medicine found that women with an untreated DVT episode had a 22% risk of stroke or pulmonary embolism, a clot in the lungs, within 12 months without anticoagulation therapy. What you should do is treat one-sided leg swelling as a potential emergency. Don't wait for a scheduled appointment. Go to urgent care or an emergency room. Ask for a D-dimer blood test and a leg ultrasound. If a DVT is confirmed, treatment, usually blood thinners, needs to start immediately. This next sign happens right under your skin. Number 4. Visible, twisted varicose veins that appeared suddenly. Many women over 60 have had varicose veins for years, those ropey, blue-purple veins visible beneath the skin of the thighs and calves. Long-standing varicose veins carry some risk, but they're not the most alarming scenario. What is alarming is when varicose veins appear suddenly or when existing ones change in appearance, becoming harder, more painful, redder, or inflamed. Sudden changes in varicose veins can indicate superficial vein thrombosis, meaning a clot is forming in those surface veins. While superficial clots are less immediately dangerous than deep ones, research shows they frequently coexist with DVT and share the same clot-forming mechanisms. A 2020 study in thrombosis research examined 4,200 women with newly symptomatic varicose veins. Researchers found that 29% also had a concurrent DVT that hadn't been clinically detected. Among women over 60 specifically, that rate jumped to 43%. Additionally, women whose varicose vein symptoms escalated had a 3.2 times higher risk of ischemic stroke over the following 5 years compared to women with stable varicose veins. What you should do is don't dismiss a sudden change in your varicose veins as cosmetic. If veins become tender, hardened, red, or warm to the touch, see a vascular specialist. Compression therapy, lifestyle modification, and in some cases, minimally invasive procedures can significantly reduce your clot risk. We're in the top 3 now. These are the ones you absolutely must know. Number 3. Sudden weakness or heaviness in one leg. Here's where we move into territory that demands immediate action. If you suddenly feel weakness, heaviness, or a loss of coordination in one leg, and it came on quickly, not gradually, you may be in the middle of a stroke or TIA right now. One of the hallmark features of stroke is unilateral motor weakness, meaning weakness on one side of the body. The legs are frequently involved because the motor cortex, the part of the brain that controls movement, is a common stroke territory. The FAST acronym that you've probably heard, face drooping, arm weakness, speech difficulty, time to call 911, was originally designed for the most obvious symptoms. But research has repeatedly shown that leg involvement is equally common and often the first symptom women over 60 experience. A 2017 study in the journal Neurology found that among women who presented to the ER with stroke, 58% reported sudden unilateral leg weakness as either the primary or an early symptom, compared to 41% of men with the same presentation. Women are more likely to have strokes that affect the posterior circulation of the brain, the back of the brain, which strongly controls leg function. What you should do is treat sudden unilateral leg weakness as a stroke emergency. Call 911 immediately. Do not drive yourself. Every minute without treatment during a stroke, approximately 1.9 million brain neurons die. Time is brain. Sign 2 is happening silently in millions of women right now. Number 2. Coldness or numbness in one foot or leg. You touch your left foot, and it feels noticeably colder than your right. Or you get a persistent numbness, a pins and needles sensation, or a dead feeling in one leg or foot that doesn't resolve when you change position. This isn't just poor circulation in the general sense. This can signal acute arterial occlusion, a sudden blockage of blood flow, or the early stages of a neurological event caused by restricted blood supply to the spinal cord or brain. Coldness and numbness in one extremity that comes on suddenly and doesn't resolve in minutes needs to be treated with the same urgency as chest pain. A 2022 study published in Stroke, Vascular and Interventional Neurology analyzed 5,700 stroke patients. Among women over 60, unilateral limb coldness or sensory loss was present as a pre-stroke symptom in 63% of cases, often appearing 24 to 72 hours before the full stroke event. That pre-stroke window is critical. It is your opportunity to get medical intervention before permanent brain damage occurs. What you should do is, if you feel sudden, unexplained coldness or numbness in one leg or foot, especially if it's asymmetric, meaning only one side, call your doctor immediately and describe the symptom exactly. If accompanied by any other neurological symptoms like vision changes or speech difficulty, call 911. And now, sign number 1. Number 1. Involuntary leg tremors or jerking movements during rest. Here it is, the sign that stopped Swedish researchers in their tracks. In 2016, the Karolinska Institute in Stockholm was conducting a long-term cardiovascular study on 8,200 women over the age of 58. They weren't looking for leg tremors. But when they analyzed pre-stroke physical data, they found something striking. Women who later experienced strokes were 4.7 times more likely to have reported involuntary leg movements during rest, spontaneous tremors, jerks, or twitching in the legs while sitting or lying still in the 6 to 18 months before their stroke. These weren't seizures. They were subtle, intermittent, easy to dismiss. Researchers believe these movements reflect early disruption to the corticospinal tract, the neural highway connecting the brain to the spinal cord and limbs, caused by microvascular damage. In other words, tiny blood vessels supplying nerve pathways were already being compromised, and the legs were twitching in response. But the combination of rest tremors plus any other sign on this list is a pattern that demands urgent cardiovascular evaluation. What you should do is, if your legs twitch or jerk involuntarily while you're at rest, not related to falling asleep, which is normal, track the frequency, duration, and which leg is affected. Bring this information to your doctor and specifically request a vascular risk assessment and brain MRI. Given the research from Karolinska, this symptom alone justifies a full stroke risk workup. Your legs have been trying to talk to you. Now you know the language. From persistent fatigue all the way to those involuntary tremors, every single sign on this list is your vascular system sending a signal. The earlier you catch it, the more options you have. Share this with every woman over 60 in your life, because the sign they're ignoring right now might be the one that matters most. Now, we want to hear from you. Have you ever noticed any of these signs in your own legs? And which sign on this list shocked you the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.